Welcome everyone to the webinar. We will begin in just a moment. Okay. All right. Welcome everybody. Hello everyone, and welcome to EPA's Decentralized Wastewater webinar series. Today's webinar is titled Innovative Technologies and Approaches to Address Decentralized Wastewater Infrastructure Challenges in the Alabama Black Belt. My name is David Richards. I'm an EPA contractor. I'll be handling the technical aspects of today's session. We will get underway in a few moments, but allow me to cover a few housekeeping items first. By now, you should have the GoToWebinar application running and should see the welcome slide on your screen. If you're having technical difficulties using GoToWebinar, please visit gotowebinar.com and click on support in the upper right corner of the page. You also may submit a question via the GoToWebinar questions panel, and we will try to help resolve your issue. We encourage you to ask questions at any time during the webinar. Simply use the GoToWebinar control panel. You can type your questions in the area that says questions, and then click send it to the moderator. We will address the questions following the three presentations. Please note that the GoToWebinar control panel may not be expanded and may look like a small gray rectangle with little buttons. You will need to expand it so that you can be able to ask questions. To do so, click on the orange button at the top of the gray rectangle. Thank you, and now I'll turn it over to Zach Lowenstein of EPA's Decentralized Wastewater Program.
All righty, thank you, David. I'd like to welcome everyone and thank you for attending today's webinar. My name is Zach Lowenstein, and I work at EPA's headquarters in Washington, D.C. in the Decentralized Wastewater Program, which manages the Decentralized Wastewater MOU Partnership and our annual outreach program, Septic Smart Week. The MOU Partnership joins EPA and 20 partner organizations together to work at the national level on various decentralized wastewater issues to ensure that septic systems are working properly, and also ensuring the protection of water quality and public health. So we're pleased to sponsor this webinar as part of this Decentralized Wastewater MOU Partnership. I also wanted to mention that we covered this topic regarding wastewater issues in the Alabama Black Belt a little over 4 years ago as part of this webinar series, which highlighted the work of one of our speakers today, Dr. Mark Elliott, who will be introduced shortly. That webinar helped bring to light the significant sanitation issues that people were living with every day, including a high percentage of homes utilizing straight pipes to discharge their waste directly into a ditch or in the woods very close to their homes. This has been a widespread problem in the area for decades, where poorly draining clay soils are not appropriate for conventional septic systems, and in many cases, the systems that would be necessary are so expensive that they can cost more than the actual house. So today's session will focus on work that has been done, including real solutions that are currently ongoing, as well as potential solutions for better managing this issue. So with that general overview, I'll now turn it over to today's moderators. Our moderators each represent one of our MOU partners. So Christopher Lindsay is with the International Association of Plumbing and Mechanical Officials, known as IAPMO, and Carl Thompson is with the National Onsite Wastewater and Recycling Association, or NAWRA. So we're very appreciative to have their involvement in moderating this webinar today. And now I'll turn it over to Chris and Carl to introduce themselves and today's session.
Well, thank you, Zach and David. It's wonderful to be here with you this afternoon, and thank you to EPA for their work in addressing these important issues through the MOU Decentralized Waste Partnerships, and for hosting our discussion today. My name is Christopher Lindsay, and I'm a Vice President for Government Relations for the International Association of Plumbing and Mechanical Officials, or IAPMO. We are a 100-year-old trade association that is an important voice in the plumbing industry. Today, as Zach was just mentioning, I'll be helping to moderate our discussion along with my colleague from the industry, Carl Thompson. Carl?
Thanks, Chris. Hi, I'm Carl Thompson. I serve on the executive board of NAWRA, the National On-Site Wastewater Recycling Association, and I also work for Infiltrator Systems, or Infiltrator Water Technologies in Old Saybrook, Connecticut. With over 500 members, NAURA is the largest organization in the US dedicated to representing the on-site and decentralized wastewater industry. We work to protect water resources and promote the economic, environmental, and public health benefits of properly sited and maintained on-site wastewater treatment systems. As Zach mentioned earlier, our focus today is on the Black Belt area of central Alabama, where many residents in this area are underserved when it comes to proper sanitation. Correcting the problem can be challenging due to lack of attention and inadequate funding, but the technology exists to solve these problems, and that technology can be modern on-site wastewater treatment systems. Today, our presenters are going to be talking about Alabama, but inadequate sanitation issues exist across the country. Dig Deep, another one of the MOU partners, has reported that 2.2 million Americans do not have running water or basic plumbing like a toilet. The 2019 report, which many of you are familiar with, Flushed and Forgotten by the Alabama Center of Rural Enterprise and Columbia University, identified communities without basic sanitation in Alabama, Alaska, California, Kentucky, Louisiana, Michigan, the Navajo Nation, North Carolina, Ohio, Tennessee, Texas, Virginia, West Virginia, and Puerto Rico. So these challenges are widespread. As I mentioned, inadequate sanitation can be solved with attention and adequate infrastructure funding. And I'm happy to report that there is some potential good news on the horizon relative to funding. Senate Bill 914, which passed recently, the Drinking Water and Wastewater Infrastructure Act of 2021, does include grants for the construction and refurbishing of individual household decentralized wastewater systems for individuals with low or moderate income. So that's good news. This hasn't passed the House yet, so there is work to be done. But it is likely that Congress will be focusing more attention on this area of environmental justice. I believe the work of our speakers is an important step in demonstrating how inadequate sanitation problems can be addressed with appropriate attention and funding. So I'll turn it back over to Christopher to introduce our speakers.
Well, when we think about the challenges faced in Alabama, which is the focus of our discussion today, it's hard not to think about the incredible work being carried out by the trio of experts who comprise our panel. So it's now my pleasure to introduce each one of them before turning the time over for their presentation. Immediately following their presentation, we will have time for a question and answer session. So please feel free to post questions during the course of the presentation into the chat window. Our first speaker is Dr. Mark Elliott. Dr. Elliott is associate professor in environmental engineering at the University of Alabama, who works at the intersection of water, wastewater, and public health in low resource settings. His doctoral and postdoctoral research addressed issues primarily in developing countries, and his recent work focuses largely on wastewater management in rural United States. Our second speaker is Dr. Kevin White. Dr. White is professor and chairman of the Department of Civil Engineering at the University of South Alabama, specializing in wastewater and stormwater treatment. His research has focused on small community and on-site wastewater systems for over 25 years, including constructed wetlands, decentralized infrastructure, bioremediation of environmental contaminants, and low-impact development. Dr. White is a licensed professional engineer in Alabama and a member of the American Society of Civil Engineers and the Water Environment Federation. And then last but certainly not least is Sherry Bradley. Ms. Bradley is the director of the Bureau of Environmental Sciences at the Alabama Department of Public Health. Her bureau oversees the permitting, installation, maintenance, use, and product approval of on-site centralized wastewater systems. Ms. Bradley was integral in the creation of the Lowndes County Unincorporated Wastewater Program, which launched in 2018 and received federal funding for the installation of 100 on-site systems for single-family dwelling in Lowndes County. Ms. Bradley's career spans over 43 years, all in the field of protecting public health and environmental health. Thank you all three to our speakers for joining us today. And with that, I'll now turn the time over to Dr. Elliott.
Thanks, Chris and Carl. Yeah, I really appreciate the opportunity to speak today, and thanks everyone for your interest in attending. As Zach mentioned in the intro, I did give a presentation now over 4 years ago, which is hard to believe, about the breadth of this problem. I'm going to go over rehash a little bit of that and give some updates on what we've learned since. But the main focus of this presentation today among the 3 speakers is going to be the proposed solutions and our evaluation of possible solutions to the problem, and then some of Sherry's experience when the rubber hits the road and you actually try to implement solutions in this area. So my first part will probably run maybe 20 minutes or so, and then I'll hand it over to Kevin for part 2. Okay, so just to make sure everyone's on the same page, and probably this is very basic for most of the people here, but I think it's important just to lay out roughly 3/4 of people in the United States have access to a public sewer. Okay, that means they flush their toilet and the water goes down the drain, down the sink, down the shower. It all goes into a sewer and is collected for treatment at a what's called a wastewater treatment plant or a publicly operated treatment works. That covers 3/4 of our population. So the remaining maybe 60 to 80 million people are responsible for treating their own wastewater on site. Okay, and by far the most common way that this is done is through a conventional septic system. That includes a septic tank where the solids settle and oils and greases float to the top, and then a drain field where the liquids go out and infiltrate into the subsurface. Okay, here's a cross section of a conventional septic system, and everyone. I just want everyone to understand the very basics. So when I talk about the soil issues that we have in the Black Belt of Alabama, you can understand why those are so problematic. You can see the drain field is buried underground. Historically, that was mostly filled with gravel. Usually now there are chamber systems where most of the trench itself is open, and there's a plastic chamber that keeps the soil above from collapsing in. But over the course of infiltration and movement through just a few feet of unsaturated soil, it's possible to get very substantial wastewater treatment for pathogens. The biolayer that forms on the bottom and the sides of the trench, and then the movement through the unsaturated soil is very effective at removing those pathogens from that wastewater, so that by the time the wastewater infiltrates and gets to the groundwater table, it should hopefully be safe to use. In the Black Belt region, we have a lot of soils. There's a lot of prairies, and there's these what are called prairie soils or prairie-like soils, or blackland prairie soils, they're often called. They tend to have a very dense clay that when it gets wet and swells up becomes basically impermeable. You can see here 2 different USDA soil maps that show a crescent of kind of that dark green brown color coming from northeastern Mississippi across Alabama. That crescent is where those blackland prairie soils tend to dominate. Okay, and you can see here, zooming in on Alabama, the University of Alabama where I work is in Tuscaloosa, so we're north of that area, but we drive south about an hour and we get to places where the surface soil is dominated by these blackland prairie soils. Geologists typically refer to these as vertisols, okay? And these soils, when they get dry, they shrink and they crack, and when they get wet, they swell up and become basically impermeable. And I think these photos, hopefully you have enough resolution to kind of capture the extent to which that soil looks basically impermeable. And you can imagine if you're putting a trench for a conventional septic system into the ground and you dig into that soil, the trench is going to be constantly inundated with wastewater. So when that wastewater comes in, even if the soil around that trench is dry, the trench is going to quickly, the soil in the trench is going to quickly saturate and become basically impermeable. So what happens is instead of the wastewater going down, it then goes up, okay? And what happens when it goes up, it can either surface in the yard, or unfortunately, if the top is backfilled with that same clay, that part can seal off as well, and you can actually get wastewater backing up into the home, which is just a terrible situation for people. And obviously there are health implications to having this wastewater either surfacing in yards or going back into homes. The difficult soil and geological conditions, they overlap with a lot of difficult demographics. So the rural counties of the Black Belt of Alabama tend to have very low population density. So that's why sewer is infeasible for most of those areas. And Kevin will talk more about the details of different wastewater typologies that we could use to approach coverage for the people in this area. Median household income is quite low relative to both the national average and the state average in Alabama. Large proportions of populations tend to be on federal disability. College graduation rates are really low. And the median ages tend to be older in these counties because young people who have options often move to other cities or counties to get jobs. So we have a lack of wastewater infrastructure, like I mentioned, the low population density. We also have a low tax base because of the poverty and the low of small numbers of people who are living in these counties. There aren't a lot of cities and towns where you have enough people together to make sewer feasible. So most of these counties, the county seat will have a sewer system, and that may be a town of 2,000 to 3,000 people. And then usually one or two other small towns will have a sewer system. But the rest of the people are really on their own in terms of having to treat their wastewater on site. And like I mentioned, because of the soil characteristics, on-site systems like conventional septic systems that are affordable, that tend to rely on infiltration into the subsurface, don't work in these conditions. The Black Belt counties, here, this map highlights 17 of them. It's variously defined as between about 15 and 20. Were named for a rich, dark topsoil that was very good for growing cotton. It's taken on more of a socio-demographic definition now and spread well beyond the area with the vertisols, where you have a high African-American population in these counties. And you'll see maps made by political scientists that have to do with voting tendencies and socio-demographics in the Black Belt. But we're talking specifically about an area that also has this very difficult soil. Poverty rates tend to be higher. As I mentioned, about 25 to 40% of the population in most of these counties is below the poverty line. And in the rural areas outside of those towns that have sewer, that rate is going to be higher in general. Okay, so with no sewer access, high levels of poverty and unsuitable soils for conventional septic systems, we tend to get different types of failures. Okay, so sometimes those failures, like I mentioned, are wastewater surfacing in the yard. You can see in the bottom left a ball that's in a pond of sewage. Kids don't think of that water as dangerous. They think of it as a puddle. So they'll pick up that ball and play with it. So there's obviously a possibility of exposure to pathogens due to that. You can see a dog in the bottom right. I don't know if you can make that out, but there's a dog actually sitting in that puddle of sewage. That's actually relatively common, especially in hot summer. Dogs try to cool off. In the top right, you can see someone has dug a trench, basically to take that wastewater across the surface and off their property. And then in the top left is what's called a straight pipe. And it's basically just what it sounds like. It's a pipe that takes the wastewater from the home and discharges it straight to the surface. When I first started looking into this problem, I thought the failing septic systems would be the most common problem, but I found that in many of these counties, straight pipes are far more common even than failing septic systems. And I'll talk about that briefly. So there's been a lot of media coverage and anecdotal evidence about this problem, but when we first started looking into it, there hadn't been a really systematic investigation of the scope of the problem, either the geographic scope or where it was actually taking place or how common it was across these counties. So there's been articles about this problem in the New York Times, The Guardian, recent ones in the New Yorker, the Washington Post, PBS NewsHour, Newsweek, and the general thrust is that rural poverty in Alabama is very similar to that in some of the poorest countries in the world, and they have some of the same conditions when it comes to wastewater. And I have to say, having worked in some developing countries, some of the conditions that I see here are very similar to what we see in rural areas of developing countries. But it's not limited to only Alabama. And there's emerging evidence about how common in poor rural areas straight pipes are throughout the United States. And we might talk about that a little bit during the Q&A. So when we first started investigating this issue, we knew that wastewater management in the Black Belt was lacking, that there weren't a lot of municipal sewer systems, that a lot of rural residents didn't have any viable options. There are options if you're in a terrible soil in a really remote location for an on-site system that are very expensive, and Kevin will talk about some of those options, but those are largely infeasible for most of the rural poor in the Black Belt. We knew that it impacted a large percentage of the population of the Black Belt, and also the lack of key infrastructure does limit economic development. Businesses are not generally willing to move into an area where they have to rely on an on-site wastewater system that might fail. They usually want to have access to a sewer somewhere where all their wastewater can go and someone else can take care of it. Because if, for example, a hotel or a restaurant, if their on-site wastewater system fails and they have to completely shut down the business, it's a major cost and risk to that business. So there were a lot of anecdotal reports, but not a lot on the actual scale of the problem. So we set out to find out what's the geographic scope of the problem, how many households does this involve, what's the volume of untreated wastewater that's being discharged, and then what are the impacts on water quality and on public health? Because if you have raw sewage, untreated wastewater being discharged onto the surface in the environment, it's going to have adverse effects on water quality. And if people are being exposed to that wastewater, it's going to have adverse effects on public health. So there was some evidence from the mid 2000s. Kevin White, who's on this panel, and then Robert Jones, who's retired from the health department, had done a survey of Bibb County. Now, Bibb County is not actually in the Black Belt. It's actually north of the Black Belt. So the soil's not as bad, but they found what I thought at the time was some really staggering statistics. So Robert organized a survey of about 4,000 homes that were not on sewer in Bibb County. That was almost every home, almost 100% of those unsewered homes. And 15% of those homes had straight pipe, which I thought at the time was unheard of in the United States. And then 50% of homes showed some evidence of sewage on the surface. So that would be either a straight pipe or evidence that wastewater was moving not into the ground, but actually up, okay? And that could be actually a puddle of sewage on the surface, evidence that sewage was recently on the surface, or even just along the field lines in the drain field, grass growing really robustly, indicating the wastewater is coming up into the root zone of that grass and contributing additional nutrients. So if you take that information from Bibb County that shows 15% straight pipes and about half of the population with some evidence of sewage coming to the surface, and you compare Bibb County to the Black Belt counties, it indicates that in the Black Belt counties, those conditions are going to be worse. So in Bibb County, about 18% of the population is below the poverty line, whereas it's quite a bit higher in some of the Black Belt counties. Two that I'll show some evidence from: Hale County at about 27% and Wilcox County at about 39%. And then the Black Belt counties also have much worse soil. So in Bibb County, they don't have that, those vertisols are not as prominent, at least. They're not as common. Most properties would have a decent soil for infiltration of wastewater into the subsurface. So we expected to see worse conditions in the Black Belt than we saw in Bibb County. And we also have to say, you know, if we're going to see worse conditions in the Black Belt, what about the health impacts? So there are some obstacles to discovering those health impacts. One is not a lot of access and surveillance for primary care physicians. So there are a lot of people without health insurance in the Black Belt, don't have regular access to healthcare, transportation issues. Most of these counties have one or two licensed family physicians. So they're sometimes even zero. There have been cases where there was not a single licensed family physician in a county. And also, if we're getting gastrointestinal pathogens or soil transmitted helminths, it's possible that if it's a result of sewage discharge to the surface, these conditions are not going to be things that people are used to looking for in the 21st century in the United States. There was a survey in the early 90s of sewage-associated helminth infection in Wilcox County, and that was done for young children in a particular program. It wasn't a representative sample of the county or even of children of that age, but they found that about a third of children under 10 in that program tested positive for one or more helminths, and that was done by microscopy. So using a microscope to look at the stool samples for roundworms or flatworms. In 2017, there was an article published that where they reported that a third of adults in their sample in Lowndes County had infection, were infected with hookworm. Okay, those data are somewhat contested by different groups. The concentrations were really low, consistently low across all the adults that tested positive, but there are follow-ups going on. So hopefully within the next 6 months or so, we should have a good decisive answer on that. There are studies, teams from University of Alabama Birmingham and UNC Chapel Hill and Baylor University who are following up on that to look for hookworm and also other soil transmitted helminths in Black Belt counties. So our research approach to try to characterize the scope and nature of the problem had basically 4 methods, okay? And I'm just gonna roll through those really quickly. One was site-by-site inspections and surveys in the Black Belt. So in Wilcox County, we tried to get a representative sample of about 300 homes. We also had some businesses and churches, but I've left those out of these data. It was somewhat staggering to me. Less than 7% of the homes in the survey had a health department permitted on-site wastewater system. Okay, these are all unsewered homes, so they're responsible, technically responsible for having a permitted on-site wastewater system. 60% of the homes in the sample had a straight pipe. That was visible upon inspection. I have to let you know that with a mobile home, it's generally pretty easy to figure out if someone has a straight pipe. You can kind of peek underneath and see which way the pipe goes, which way the plumbing goes, and then it's relatively easy to find if they have a straight pipe. But about a third of the sample did not have a permitted system. They did not have a visible straight pipe, and that indicates that either they have some form of in-ground disposal, but not permitted, so probably an unlicensed on-site wastewater system installer, or possibly more likely, they had hidden straight pipes such that it couldn't be detected, okay? And when I say straight pipes were visible, some of those homes actually have some form of solid settling, either a septic tank or a 55-gallon drum that's buried, or you see people bury things like old refrigerators, just something to take out basically the solids and some of the oils and greases, and to prevent toilet paper and things from getting out into the point where they're discharging, whether in their yard or in the woods nearby. So that created some alarm, frankly, when we found that greater than half of our sample had a straight pipe and only less than 7% of our sample actually had a permitted system. So if you zoom in just on one example community, it's kind of a common pattern. The more desirable properties that are along the river, more of them had permitted systems, okay, that were, they actually had a permit registered with the health department, or they don't have a visible straight pipe at least. Now, it's possible that some of those homes were actually discharging with a pipe into the river that they installed in the middle of the night. You can't rule out that possibility. And then as you come up the hill to a more informal settlement with a lot of mobile homes, there were many more visible straight pipes and no permitted systems. So that's a general pattern that we see. Mobile homes are more likely to have straight pipes, and more expensive properties are less likely to have straight pipes, which I think one would intuitively have figured out. So in terms of getting a handle on the issue, doing site-by-site inspections is really not easy. It's actually very difficult, and we hired local people to do the surveys. Robert Jones, who worked for the health department, was the environmental health director for that region. And actually, his wife was a home healthcare nurse, and they knew people in a lot of communities from her work as a home healthcare nurse. So we can't just go out and do surveys on our own. It's not safe for either the faculty or the students to do that. So finding the right partners to investigate these issues is really essential if you're thinking about doing an investigation of your own. So another thing that we can get as a source of data without doing the inspections is just talk to local stakeholders, people who know what's going on in their own communities. So mostly I've been dealing, when I talk to local stakeholders, I talk to septic system installers, people who've been working in the area for a long time. They know the communities, they know who they've installed systems for. They know often who asked them to install a system that would not have been permittable, that they probably got someone else to install something. They know who has a 55-gallon drum buried in their backyard with a pipe running out to the woods often. Health department staff are kind of in a difficult situation for this, so I try not to rely on them too much other than for very general information, more than not specifics about who does and who doesn't have a permitted system. And then New Bern, Alabama is an area with an impermeable clay soil. So we got some, and it's well known to have straight pipes. So I got some expert knowledge from there. It was an area where we were sampling water, as I'll talk about shortly. In New Bern, they have this impermeable clay soil. I talked to someone who had installed on-site wastewater systems there for over 20 years. He said about 10% of people in that area have a permitted system, and it's a town of about 200 or so people. That means 90% of the population would be unpermitted systems. He said 40% probably have some field lines. They tried to put a system in, but not a permitted system. So a less expensive version of an on-site system, with about half of people discharging their wastewater to the surface, either with solid settling or not. So among those with a straight pipe, he estimated that about 60% of those had some form of solid settling, where they were trying to take out the solids from the wastewater. They were trying to not let the toilet paper come out. And then 20% just a pure straight pipe where toilet paper and everything would come out onto the ground. Most of these straight pipes are either to a ditch or another low area, usually off into the woods where people don't have to see it, and ideally don't have to smell it for much of the year. But I will let you know that solid settling doesn't do much to remove pathogens. So nearly all the pathogens are getting out into the environment. Flow routing and water sampling. So we use some GIS methods, or geographic information system, to figure out if someone did have a straight pipe in these areas, where that flow would go. Okay, and I just have an illustrative example here. One of my former students who had great skills in ArcGIS developed a method to take a digital elevation model, like a topographic map, and figure out if a home had a straight pipe, where that wastewater would go once it hit the surface. And he also developed a method so that we could figure out how much flow was collecting in those creeks, so we could identify points where we could sample and capture that wastewater after it rained. Now, typically with these straight pipes in Alabama, we have a fairly flat topography in this area. So when someone has a straight pipe, it's usually not directly into a perennially flowing stream, but rather into a trench that's dry most of the time. And then when it rains, all of it rushes off at once. And I'll show you some of our sampling results from taking advantage of that condition. So here's New Bern. I just put it into this red rectangle. State Route 61 runs north to south through the town. So Big Prairie Creek runs just to the east of New Bern. It gives us an opportunity to sample both up gradient and down gradient, so both upstream of town and downstream of town, and capture wastewater that runs off when it rains. So Road 61, you can see that sampling point. There's a bridge. We drive all these sampling points that we use are bridges, so we can access the water either with a pump over the edge of the bridge or walking down and grabbing samples. But it's a pretty small watershed. So upstream, there's really no human influence. And then downstream, it includes all the impacts of the runoff from those straight pipes in town. So just one figure of some of our sampling results. We had a long drought in the fall of 2016. There was basically no change in the E. coli concentration from upstream to downstream during the drought. After the drought broke, the concentration of E. coli increased across the board, but it only increased by a factor of about 10 upstream. So all warm-blooded mammals shed E. coli. So so if there's birds and deer and dogs or whatever, that's gonna increase the E. coli counts upstream. But once you got to town, Adjacent to town, which was capturing some of the straight pipes, but not all, we saw a factor of about a factor of 100 increase. That's a log scale on the y-axis. And then downstream, we saw about a factor of 1,000 increase. So we saw a lot more fecal microbes downstream of town than upstream. And we think those are largely attributable to the straight pipes. And we're just starting a new round of sampling post-COVID so that we can actually look for the genes associated with the human fecal contamination. So the transition that we're making now, and it corresponds to the transition that will be between my presentation and Kevin's, is from characterizing to addressing the problem. So we've largely focused on characterizing the problem, and that work will continue. But we're trying to shift to our major emphasis to actually addressing the problem, to categorizing and defining the barriers to wastewater solutions, developing solutions that are appropriate to specific communities in the Black Belt, and then leveraging partnerships and resources that we have to implement those solutions. And we'll talk about the Consortium for Rural Alabama Water and Wastewater later on and how we're using that. But basically, in terms of a path forward, there are different things that we could or should do, okay? One would be to expand or upgrade existing municipal sewer systems. There are major cost issues with that, but it may be appropriate for some developments that are really close to existing sewer systems. Appropriate on-site systems. Technical funding issues. We need the right technologies. The health department is involved in that, and Sherry will talk about some of her work in that area. Identifying clusters of homes for decentralized collection and treatment. Kevin will introduce decentralized clustered systems and the kind of systems that we're looking at. Identifying cost-effective treatment technologies regardless of the scale of the wastewater collection. Identifying management entities. Sherry will talk about particular challenges in actually getting management entities working on this problem. Exploring viable financial models for capital and O&M costs. There are a lot of factors that have made decentralized clustered systems much more financially feasible than they were even 5 years ago. And while sewer and infrastructure costs continue to increase, Kevin will talk about some of that a little bit more. Developing alternative regulatory strategies. So there are some areas where there's really not a good solution that can be achieved without discharging to the surface. And we're looking at ways that basically the Clean Water Act prohibitions on discharge to the surface without a monthly monthly sampling and MPDS permit could be avoided. And then developing a how-to guide. A lot of these municipalities, most of them, don't really have the resources to go after the funding that's available to solve these problems, nor are they really familiar with the solution space and what technologies they should be looking into. So with that, I'm going to hand it over to Kevin, and feel free to put your questions into, send them to the moderators, and I will be happy to address those during the Q&A session. Thanks.
Okay, thanks, Mark. Good background discussion there on what's going on. I want to move forward with some of the proposed solutions and strategies that we think we need to address these issues in these rural communities without a lot of resources available to them. Okay, so Mark identified a number of obstacles. And so in the years that I've been working, in this area, in the small community and on-site, and looking at the Black Belt issues, we have a lot of obstacles. It seems like every which way we turn, there's an obstacle. He mentioned the soils. We can't get anything to go in the ground. So that makes more conventional type systems much more expensive if we were to try to get it into the soil with various types of technologies, mounds or drip irrigation, etc. The population density, low population density, doesn't lend itself very well to traditional sewering. It's too expensive. The people that live here are typically low income, so they don't have a lot of resources. There's not a lot of tax base here to raise funds for a lot of this. You know, what are the technologies? We have a lot of technologies available, but we really have to be smart and pick the ones that can be most cost effective for these situations. And then we also have what I believe is probably one of the most limiting obstacles, and that is, how do we manage these rural systems, whether they're on-site or clusters or even small municipal systems? How do we manage that? What is the best way? What is the most cost-effective way to manage these systems? And that kind of leads into the financial modeling, you know, for capital cost and O&M cost. We think there's opportunity, particularly with new legislation that Carl mentioned earlier, to provide more funding for rural communities, water and wastewater. We may be able to obtain the capital funding that we haven't been able to in the past, but we still have to provide for long-term operation and maintenance in a rural, low-income community, and that's a challenge in and of itself. And then finally, the community guidance. Most of these counties have populations of around 10,000 people, plus or minus. So they're small counties in terms of population. Tax bases are low. They don't have a lot of governmental oversight and regulations, and so they're really looking for assistance, and many of them don't know exactly where to go to get that assistance and guidance. So we've come up with this plan that Mark sort of mentioned to address what we think are the biggest obstacles. And the goal in this is to get as many people as possible onto a managed wastewater system of some type. So starting at the top left there, the expand existing sewer where that's feasible and available. In most of these counties, there's only 2, maybe 3 small communities that have a municipal sewer system. Implement decentralized cluster systems, 25 to 100 plus homes that are within, say, about a 5-mile radius of one another. Maybe we can tie those together with some type of small diameter pressure sewer that would be as economically feasible as possible. Thirdly, to address in some ways the individual on-site needs with some innovative solutions, and innovative may mean technology, but it also may mean oversight and management. Fourth, and Sherry's going to talk about these on-site and one of the innovative solutions with the Lowndes County Unincorporated Wastewater Pilot Project that she's leading in Lowndes County. So she'll talk about that shortly. But also, fourthly, consider some new regulatory strategies. And we are talking to, obviously, Sherry Bradley with the Health Department, but also with the Alabama Department of Environmental Management, the state EPA office, if you will, about some potentially new ways of thinking about these rural communities and their wastewater management. And then finding appropriate management solutions, which I think is key to making all of this successful. So we're looking at a number of different things related to this path forward. These rural and underserved communities obviously need help, not only to protect their public health, but to improve economic development and economic outlook. As Mark mentioned, without sewer infrastructure or wastewater infrastructure, they're not going to be able to attract business and industry. And so we think not only is this a public health issue, but it's also a way for these communities to grow economically and provide jobs for those residents that are looking that way. So we're trying to look at these methodologies in order to provide for a path forward. So I'm going to talk about a couple of specifics. Let's talk about expanding existing sewer. Small towns, county seat, as Mark mentioned, I'm gonna use Wilcox County as an example. Camden is the county seat of Wilcox County, right in the center there. There's only 2 permitted wastewater systems, municipal systems in Wilcox County. Camden has a population of about 2,200 people, and Pine Hill has a population of about 930 people. We currently have an EPA funded project, Mark and I, that we've actually hired a consultant to identify in 5 targeted Black Belt counties where municipal sewer expansions might be feasible. So could we extend the existing sewer, a mile to the east and pick up another 15 homes, or extend it a mile to the north and pick up another 18 homes? Again, with the goal of getting as many people as possible onto some sort of managed wastewater system. And then also, how much of that sewer is possible, linear feet or miles, and what might be the cost for extending that collection system. So that is underway in 5 counties. We're looking at that. We also know that we're trying to find appropriate single home systems. How can we treat wastewater in these homes that have clay soils and don't have a lot of income, subsidies from USDA, like the Health Department pilot program in Lowndes County that Sherry's going to talk about. Maybe doing more comprehensive soil surveys to identify where reasonable soils might be located, so that we can locate soil infiltration systems where that might be appropriate. And then also looking at these clustered systems, particularly utilizing the innovations that have come along in the last 10 or 15 years related to communications, remote monitoring, economies of scale, et cetera, so that we can make these systems as cost effective as possible. So if we look at a close-up of Camden, Alabama, the red line denotes the city limits of Camden. Camden does have a municipal wastewater system, and what we're talking about is looking at areas surrounding the existing municipal system, like I show there in yellow, potential sewer expansions. Just to the west of Camden, it may be feasible to run sewer along that Highway 221 and move it to the municipal sewer system, and it looks like we could tie in quite a few homes there. When we're talking about expanding or connecting to sewer, we've got to look at cost, obviously. If we're talking about gravity sewer or sewer of any type, it's reasonably costly. Gravity sewer is $50 to $250 per foot, depending on the pipe size, plus manholes and things of that nature. You've got a lot of labor costs there for trenching. You've got materials cost and hookup costs at the home, depending on how far the home is from that sewer main. So you've got a lot of costs associated with this. So we got to be careful and look at what makes sense from a cost standpoint. In terms of decentralized clusters, again, that we've got lots of tools available to us in the treatment and collection toolbox, but we want to try to look at the most cost-effective options. Again, potentially for remote monitoring, multiple systems, these cluster systems in each of the counties that are having these wastewater issues, and then the financial management and O&M management utilizing economies of scale. So again, back to Wilcox County, the county is outlined in the faint red line there. We've identified 15 possible cluster systems of 30 or more homes in Wilcox County. And you can see I've kind of drawn a little yellow line around a couple of those clusters. So those dark yellow circles are individual 30+ home clusters, but we may be able to cluster 2 of the smaller clusters together and get 60, 70, 80 homes onto one decentralized wastewater treatment and disposal system. I'm going to focus in on the red box that's labeled Furman Snow Hill Cluster in the next slide. And these are 2 communities that are close together. And if we take both of those communities and run a sewer line, where you see the red lines there, we can actually connect 75 homes to a centrally located cluster treatment system that would have a design flow of around 19,000 gallons per day. So that's what we're talking about, looking at where there are possibilities of clustering these rural residences to get them onto managed sewer. In terms of collection, how do we do that? What's the most effective way of doing that? Well, there's several things to consider. If you look at gravity sewers and pressure sewers are what I would call grinder pump sewer. You know, both of those transport both liquid and solids. And so once the wastewater gets to the treatment facility, we've got to handle both liquid and solids. And as anybody that's ever operated a wastewater treatment facility knows, the solids handling is one of the more problematic and one of the more costly things that you have to do at a wastewater plant. So by going to a collection system like the septic tank effluent pump system, where you have a septic tank, or some call it an interceptor tank, a primary settling tank at each home or residence, the BOD and suspended solids that are moved through the small diameter sewer is greatly reduced. And so we have almost no solids to deal with at the treatment facility. Much of the solids that are collected in the septic tank will be liquefied over time. And we've seen evidence in a number of locations around the country that these septic tanks and effluent sewer systems only need to be pumped of solids on about an 8 to 10 year cycle. So quite a long time. And if you look at what that costs, $350, $400 over 8 or 10 years, that works out to be only a couple of $2 or $3 a month on a sewer bill to recoup that. The step cost versus gravity and pressure in terms of installation, somewhere for a normalized 50,000 gallon per day system, about 200 homes. The step and pressure are somewhere mid $300,000 up to low $500,000 range, whereas gravity sewer would cost about 4 times that. So it looks to us in terms of cost effectiveness, it would be much better to do a small diameter collection system. And when you take into account the lack of solids being moved to the treatment plant by step sewer, we feel like that is the most cost-effective option. So we get small diameter sewer lines, which are less expensive to install, and we have minimum solids handling at the treatment facility. So that gives us more maybe better, but certainly more treatment options once we try to settle on a treatment system. So this is sort of a diagram, a illustration from a Rinco on an interceptor tank or a septic tank, primary treatment tied into a sewer main, liquids only. They're putting in a system now in a small community in Lowndes County, 300 homes. Each of them will have a primary treatment system in each home. About 2/3 of the sewer line is 2 inches in diameter. There is some 3-inch and there is a little bit of 4-inch line, so maximum 4-inch sewer line in a small community of 300 homes. Our treatment options are many, from the very simple pond wetland type systems, and then getting a little more and more complex, recirculating media filters. There are various types there, aerated systems of various types, and then all the way to the more complicated membrane bioreactors. But not only are there more complications with some of these systems or less, but there's also the effluent quality. So typically in the pond systems, your effluent quality is not as great, whereas the membrane bioreactors can provide, very high quality effluent. And depending on what we do with that treated water might depend on which one of these treatment systems that we select. So it depends on the effluent fate and the cost as to which one of these might be best. All of them we would like to be able to build them in a modular fashion, so that if the installation of collection leads to economic development, we could potentially easily expand the system to handle additional wastewater. In these rural communities, simple operation and maintenance and low operation and maintenance costs are important. And because we're looking at cost effectiveness so closely, I've recently had a student look at life cycle costs for a number of different types of treatment systems. And I've got a little table here for the operation only. That's the second column there, operation per household per month, life cycle costs. We've got an aerated attached growth type treatment system, recirculating media attached growth type treatment system, a constructed wetland, and a membrane bioreactor. And you can see the costs. The lowest cost is the wetland system. The highest cost is the membrane bioreactor. We also looked at these life cycle costs with capital recovery. And that obviously ups the monthly cost per household. And then also with capital recovery and a 30% overhead per household cost per month. And this will tell us, some things about, can the community afford this type of wastewater treatment, wastewater management. So we're looking at those things like life cycle cost over 30, 40-year period of time that would include replacement cost and maintenance and all that kind of thing. Again, just a few illustrations of the different types of treatment options. Again, we would like to have these systems to be modular, relatively simple to operate, and low O&M costs. And finally, what do we do with the treated effluent? Well, that's really the probably most difficult technical option. Drip irrigation will work in many cases, but it's also relatively expensive. Sherry may talk about this a little bit, but we're putting in a system in Lowndes County now for 5 households, and to get a drip irrigation in for 5 households, we had to bring in 39 dump trucks of dirt, fill material that had a hydraulic conductivity appropriate to put in the drip irrigation. Spray irrigation is another much more cost-effective option, but regulatory constraints on spray irrigation right now basically prohibit it in most cases. So that's one of the things we're talking about with ADEM is, how can we come up with a treatment disinfection system that would allow some type of spray irrigation for either individual on-site systems or cluster systems. In-stream disposal, like a lot of municipalities utilize. Currently, the way most state EPA offices manage stream disposal is through NPDES permits. They run a Streeter-Phelps model to see how much dissolved oxygen sag they get by disposing a certain concentration and flow of wastewater. And in many of these small rural areas discharging to small streams, the stream may not can take very much in the way of BOD in the effluent. So we need to look at options that will allow some in-stream disposal or spray irrigation to overcome those issues. And also reuse. How might we reuse some of this treated effluent? It might be irrigating timberland. There's a lot of timberland in the Black Belt. Grow pine trees, and maybe it accelerates the growth. The wastewater will have nitrogen and phosphorus contained in the wastewater. Hay fields to grow hay for potential animal feed. A lot of that occurs in some of these rural areas. And then also things like plant nurseries. Can we irrigate plant nurseries to grow azaleas and other plants that could be sold to various big box stores that we all go down on Saturday and pick up a few plants to plant around our home. So this may even be jobs for the community. So we're looking into potential ways of reusing treated wastewater. And again, that may depend on how we have to treat the wastewater in terms of the method of reuse. We're also trying to look closely at management models. How do we manage this? Typically, it's been whatever community wants to put in a wastewater system, that community manages it. But that means we might have a lot of small management entities, and each one of them have very few rate-paying customers. So it may not be a sustainable model. So what we're looking at is larger management entities that have more customers. And that might mean a larger existing utility. For example, could the Montgomery Water and Wastewater Utility in Montgomery, Alabama, that has tens of thousands, maybe hundreds of thousands of customers, could they have a rural management division that manages small wastewater systems in 2 or 3 counties nearby? What about a county level management entity? What about a multiple county management entity? Rural water providers. I'm talking next week at the Alabama Rural Water Association meeting, and we really want to have a conversation with them about, how would it be best to get multiple decentralized cluster systems managed by a large umbrella management entity. Even electric co-ops that serve the region, or even solid waste managing entities that already are in existence and have a billing structure in place. So we're really trying to think outside the box here on management models to make these systems sustainable long term. And then finally, regulating and permitting, in-ground versus surface disposal. There are some flow demarcations, 15,000 gallons per day. In the ground is health department, and greater than that is ADEM. What about spray irrigation? Can we come to some agreement on allowing a more cost-effective way of disposal using spray irrigation? And we're talking about that. State revolving loan funds, either through the state or through the federal government, to provide some amount of funding that small communities or larger management entities can go and get funds to put in either on-site or cluster systems, USDA, community development block grants. What are the best ways to go about this? And I'm glad to hear that some movement on funding smaller systems has just passed the Senate. And maybe that will come to fruition and help out tremendously. The reuse question, how can we reuse this treated water? And then finally, special permitting districts. I feel like that in this area where we have low income, low population density, clay soils, maybe there should be a special permitting district to allow some things that would be more cost effective and more likely to be implemented and sustainable than what we do in the rest of Alabama or the rest of the country. There are some examples of general permits for specific geophysical reasons, high water table in Louisiana, unsuitable soils in Ohio, etc. So we're talking with both the health department and ADEM about these special permitting districts. They haven't come about yet, but at least we're talking about them. And then some of the on-site options that we're looking at in these clay soil systems. Very briefly, drain field mounds that are common in a lot of places, and these soils are very expensive, $6,000 to $10,000. And then some of the other more advanced treatment systems, again, are a little bit costly and require maintenance. And we can go to more simple systems like wetlands. And we are experimenting with black water separation, treating that black water with wetlands and gravel mounds. And then finally, lateral flow sand filters, which we're testing as well. So there are some options that are not typical, like the black water treatment and the lateral flow sand filters. And depending on how these tests work out, we may be able to test these systems out on the full scale. And finally, I'd like to really acknowledge that a lot of what's going on here in the Black Belt has been a result of a lot of collaborative activities. We formed a consortium for Alabama rural water and wastewater in 2018. And it's consisted of universities, the regulatory community, our governor's office, congressional representatives from Alabama, trade associations, private companies, et cetera. And that's really given us a lot of momentum to look at options and try to implement some systems that will demonstrate that this can be solved. I'll point out to you that there is a United Nations sponsored hack that's talking about sanitation in the Black Belt, of about 12 to 15 hacks, which is really just a brainstorming session on trying to come up with solutions. This Black Belt one is the only one in the US focused on something in the US. It's going to be on June 5th and 12th online. If you're interested, go to unleash.org. And I'm going to turn it over to Sherry, and she's going to talk about a specific project in Lowndes County for on-site wastewater.
Thank you, Dr. White. Okay. Thank you for having me today. I want to kind of give you my journey through the creation of Lowndes County Unincorporated Wastewater Program For short, I started calling it LCUWP. As you know, through the introduction, I work for a regulatory bureau. And what we do, we regulate the permitting, installation, maintenance, and use of on-site sewage disposal treatment systems. In 2017, the UN representative came back to Alabama. As Dr. White said, he was here earlier, but he visited Lowndes County again. And when I read the report, and I quote, "I think is very uncommon in the first world," he was talking about straight pipes. Now, he did meet with the state health department, but little did we know that he met with us after going out to the site, after talking with some of the prearranged visits. And by the time he came to us, the health department was the bad guy. So our new state health officer said, "Sit here, don't say a word." And we took everything that was thrown at us. Prior to the UN representative coming down, there had been plenty of meetings on Lowndes County. Mainly because every 3 years, there's some publicity about Lowndes. Dr. White showed it where the New York Times and all the different newspapers would post certain information about Lowndes County. I never attended any of the meetings for the simple reason I knew it would take money to fix this problem. It would also take affordability of the system if we're talking about people that's very poor. So we're talking about affordability, we're talking about funding, and we're also talking about innovative systems. Dr. White is working on those systems. I was working on our sister agency, and here of late that regulates surface discharge. And one of the things they've done is allowed us to surface discharge gray water with guidelines attached. Now, when the UN representative left, that sort of what they call fired me up. I'm a regulatory bureau. I have a certain responsibility, but I did ask our new state health officer, give me a shot at trying to bring a solution or bring a best practice model to Lowndes County that other counties can look at, duplicate. My first meeting in Lowndes County was in January 2018, and 5 people attended, not counting my office staff. One of those people was the county commissioner, one of the county commissioners. So what I did that day, I gave what they call a cheerleading session, saying we can do this, we can turn this around. This is what we need to do. Because I had sat and I had strategized on what we was gonna do, and but I still needed money. That's where Congresswoman Terry Sewell, on a regular basis, she held community meetings. I started attending those meetings. She did introduce a bill back at that time through USDA on wastewater disposal. It wasn't the perfect fit for what I was trying to do. This was my idea, the Bureau's idea, was the first time that USDA had looked at an application like this. And so with USDA grant application, 75% of the grant, 75% of the funds were grants. 25% of it was money I had to come up with. Now I'm a state agency and I've never asked anyone for funding, but I've become an expert at it. One of the things that USDA said was do not compete with other municipalities. So what I did, I took what nobody wanted. That was the unincorporated area. USDA also said that they wanted to see if I could help with some local legislation And I did not understand why that local legislation was not introduced to the county through the county commissioners. Well, what they needed, different municipalities in Lowndes County, they had grant money and they wanted the people to tie in. They didn't want to, and they refused to. They refused to tie into the municipal systems they already had. And when I asked why, they said because it costs money. Well, yeah, it costs money, but if you move from Lowndes County to Montgomery, you don't have a choice. You're going to be on city sewer and water. Another buy-in was that I need to come up with an idea to make this affordable. So what we did, we sat down, we said, when we go out, when I send my soil scientists out and they look at the soil, if it's good soil for a conventional system, there would be a one-time down payment of $500. If the soil is black belt soil, it's a one-time fee of $1,000. And then it's $20 per month. Just like you have a water bill, now you will have a sewer bill. Now you would think that everybody can pay $20 per month, but I found out that some people I was informed that they couldn't. But the buy-in, one thing that you have to look at, if you're going to get a system where a grant is paying for the majority of the system, you have to buy into the idea. That's what the one-time down payment fee is for, but it's also for another reason that I will get to on the next slide. Another attempt that was tried for this project was hook up with the Lowndes County Water Authority. If you do that, your administrative costs would be low because the USDA funding was construction costs, earmarked for construction, no admin costs. I made not one, not two, but 3 trips to the Water Authority. I explained the project from beginning to end, how the locals would have to fill out a simpler application. They would have to verify with a picture of their driver's license. I needed their income verified. I needed their deed to the property because you have to own your property. Very simple application. The Water Authority did not want to join in the project. And I've been going before the Lowndes County Commissioners for 3 years now, keeping them abreast of everything with this project. At one point, I thought about getting the project to a certain point and turn it over to the county commissioners. They did not agree to that. So that's why I had to go further with the project. Now, concerning the project, I've had some stumbling blocks, but I've had success up to this point, and I hope it continues. What makes this program different is, and Dr. White said it best, we were installing these high-tech systems, and we expect the homeowner to maintain them. With this project, if you join the LCUWP, that $20 a month is your maintenance fee. Maintenance would be supplied by the Alabama On-Site Wastewater Board. They will also do the enforcement, some of it. The maintenance, what the compliance officer would do, they would go out and make sure that the system is not being abused. They would make sure that certain items are not going into the system, like a ton of Clorox. 2 years prior to starting this project, the Bureau had a system put in for free for an 85-year-old lady. She was told what not to put in the system. Only a year later to call and say the septic tank system is not working. When we went out and we looked at it, everything we told her not to do, she did it. She poured in a ton of grease, cigarette butts, we had to sit down and go over everything with what not to do again. We even kicked off a program on gas tops saying how to maintain your septic tank system. That went statewide. We had billboards. We were trying everything we could to enforce or implement this education. June 19, 2019, the LCUWP Sewer Board was created. It was created, a EIN, DUNS number sought after and received, 501c3 was approved because I could see everything coming together. Now, understand the LCUWP Sewer Board had no money. We had not gotten any money yet. So the engineer that is on contract with my bureau, he is the engineer for this project. He also has land surveyors that have gone out and surveyed the property. And we have found some problems, and I'll share that with you in a later slide. But also the complexity of the USDA application itself took 2.5 years from beginning to end. Only for me to find out that that's the norm, that it takes about 3 years for USDA to fund a project, but that's the norm. We kept changing the information on the application and we've gone from 100 homes now to 175. The engineer firm actually completed the application. I did not complete the application. I was the only one in the meeting, however, with Congresswoman Sewell to raise my hand and say I wanted to do it. Little did I know, and 3 years later, that was a big bite. To this day, we've had one person in Lowndes County to donate funds to LCUWP. None of the churches, none of the local officials, except one, has donated funds. The biggest contributor, starting from EPA, starting from Black Belt Foundation, Porch Creek Indians, the governor's office, and many more have contributed. So as of December 2020, we met our 25% match. And we verified that to USDA. They have to have verification. We verified it. And now we're on the road. The back end concern as well as the front end concerns. You have people that have seen straight piping all their lives. And some of them think it's normal, and it's not. It's hard to get people to change what they've lived with all their lives. I am finding that the property, you have a lot of air property, where you have all the family members, the grandchildren names on the property. I'm finding where the lots are too small for installation of a drip irrigation system. I have people with a half an acre, but they need more acreage. Now, the solution was that I did go to the county commissioner. I did ask, can you pass some type of ordinance that if you subdivide, you need to sell at least an acre, not half or a fourth of an acre at a time. I'm still waiting on the answer from that. I will show you a picture where you have homes. Well, there are homes in Lowndes where once I had everything surveyed, half of the house sit on the owner's property, the other half sits on the neighbor property. We've got a lot of that. We've got makeshift systems where you don't see the sewage, on the ground. They keep it off the ground. But if you walk to your neighbor's property and you put dye in the system, that makeshift system is not working. Impersonators of the Lowndes County Health Department. In my visit, I had resistance for people. I could see a person walking their home. I could go behind them and knock on the door. They wouldn't open the door. What we had to do was find a community leader. And this project would not have worked without a community leader. The person I found, she was on Facebook. She was on. She had tapes where she was bashing the health department, where the health department did this, the health department did that. So one day I told my coworkers, let's find this lady. We found her. We were not friendly to each other at first, but now we're the best of friends. And she's the best worker. She's out there voicing for everyone to get a system. But for any small town community, if you have a project of this type, you must have a community leader. Another problem that I have here is that the one-time down payment, I would find donors for that. So when I tell the people, okay, you got to pay $20 a month. Well, I can't pay $20 a month. Now, at some point, I think when you tell a person they're poor and you tell them that over and over, or that they don't have this, I think sometimes they start believing it. But the point is, $20 a month, you can pay. Some people in Lounge don't want the program to succeed. The more I work it, the more I hear myself, the more I see myself on the news. If I give an interview, that person had been called to come in and turn around everything they said, cut and paste, to the point I'm gun shy. But the program has succeeded. It's succeeding. I've had my first $1,000 down payment submitted. I've got people calling left and right. They know that the health department can come out. We'll talk to them about what they need. They're not afraid. They never have been, really. So what I want to show you is some of the things that, because I stay in the field a lot. Now this is typical, like Dr. White said, but this hole is 3 feet deep. We measured it, and a toddler could fall in that hole and never be seen again. This young lady, the day I went was on a Thursday. She had COVID. Her mother had COVID. I came back that Monday. Her mother had passed. Now, we do know it's a known fact that if you have COVID, that the virus does shed in the wastewater. So we are, I'm trying to get her land straightened out now so we can put a system on it. Okay, this is the slide I was telling you about. If you look on lot 7 to the bottom left, this is the lady with the hole I just showed it, the straight pipe. Next to her is her sister with the white top. To the right is the mother. Half the house is on lot 7, half is on lot 8. The way that we straightened this out was that our legal team said that if the outlet from the house is where the septic tank can go, then we can install a system. Gray water coming out, but I think that what I want to show you on this picture, she has a pipe for gray water and she's got a pipe for black water. But this particular pipe is going straight to her. It's an abandoned well, but she's contaminated the water table. Now, let me say this. Education is needed, but I found out quick and I found out early. Don't say education. Say I want to share some information with you, because for some reason, sometimes people think you're talking down to them. And that wasn't the case at all. But we've come a long way in learning what to say and what not to say. Now, this house was shown earlier. Yes, the system is more expensive than the house. But this particular system has a story. The house has a story. The person in the house has a person over them with a power of attorney. That individual wants a system, But on the application, if you got POA, you have to give us a copy of the POA. The lady said, I'm not going to do it because y'all will take this house. So that's something else. We got impersonators. We got people saying the health department will take your house. You got people saying the health department lock you up. And that's just not true. This is a typical yard showing 2 days after a heavy rain. And this water stayed in her yard for quite some time. This is another individual that has paid her one-time down payment fee. So people are saying that they don't have it, but they do come up with the money. Now, Dr. Elliott talks about a 55-gallon drum. This is a typical example. It looks like he has a system. He does not. And when we ran and we looked over the yard, basically it did come up. So we know who has and who has not. That's just a quick review. I'll turn it back over to Carl.
Thanks, Sherry. And thanks to all the presenters. Great job. We've got a lot of questions that have come in. I'm not sure we'll be able to address all of them in the time that we have, but we will give it a shot. The first question we want to ask all three presenters is, how can communities apply the engagement strategies that you discussed today to challenges faced in other communities? So it's kind of some of the things that you learned, Sherry, and others. What should other communities do based on the challenges that you face? So what advice do you have for others?
The advice that I have, you've got to have a community leader. You've got to attend any community meetings that are there, like the county commissioners meeting. Let them see your face. When people start trusting you, they do what they do now. They call us up on the phone. Say, I need you to come out. I've got a straight pipe. They tell us they have a straight pipe. Communicate with your congressperson. Communicate with your local legislator. We've got Kelvin Lawrence in Lowndes County that actually was the one that passed that local ordinance that I need. So you have to get in there and you have to introduce yourself. Someone said it earlier in my cohort meeting. Don't expect it for the person to be here. You got to understand where they are. And once you understand where they are, you can relate better.
That's helpful. A technology question. So what specific technology challenges were overcome to provide the appropriate decentralized wastewater needs?
Well, I can address that briefly. I think when we're talking about the decentralized, certainly the cluster systems, the potentially most costly thing was the collection system in this rural low population density area. And that's why, after doing life cycle analysis and determining what the cost per household, and then evaluating, what the different collection systems feed to the treatment system, it sort of appears to us that the most cost-effective solution for collection is the effluent sewer type system. So to us at this point, in this particular situation, that appeared to be one of the technological solutions that might make this feasible. Now, we still have probably the biggest issue is, what do we do with the treated water? And that's why we're looking into reuse options, looking into the special permitting districts, and trying to talk about spray irrigation and some of these applications to make the whole system more cost affordable and thus long-term sustainable.
I have one more thing to add about the technologies. So we haven't actually installed our decentralized clustered systems yet, but general trends are such that in this area, a permittable on-site system is really expensive. Sewer and infrastructure costs continue to increase in the United States. So all infrastructure projects typically are overrunning on cost and time. The key components of these decentralized clustered systems, the advanced treatment, typically modular treatment, that's also a key because you can install just the treatment capacity you need at first and expand the treatment capacity easily as you need, as your system expands. The sensors that are needed for remote monitoring and management, also the information technology for remote monitoring and management, whether it's cell or internet. And one more thing, the technology, the treatment technology, the information technology, the sensors. So the sensors that you need to detect if something's gone wrong with your system are really important. And then the economies of scale. So we have grants to subsidize the installation of our first few systems. We're hoping that once those first few systems are installed, we'll build local capacity to keep the costs low. And keeping the costs low is really essential for this. But I really think with wastewater, decentralized systems are going to become dominant over the coming decades. They're going to be much more affordable.
I'll hop in with the next question. In my experience working with you three, you've all done a wonderful job in building partners in this effort, from Alabama's congressional delegation to state leadership to academia to manufacturers like Lixil or American Standard who are working closely with you on these projects. What role have these partnerships played in shaping your work?
Let me take without Lixil donated or is donating low water use fixtures that's going into the first installation that Dr. White talked about with the FujiClean systems. When those installations start going in, those fixtures, I received so many calls that day. The people were so happy. They started talking all out in the neighborhood. But without the fixtures, this project, it would have been hard, because everybody want to know what's in it for me. Well, if you let us do this, this is what's in it for you. You've got some new fixtures and it's low water use. It's going to help you with your on-site system. And I am just elated that we got contributions like that.
And there's another advantage to that. They may not realize it, and it may not have been described to them, but by having a private partner like American Standard / Lixil donating these low flow fixtures, that's going to save these residents money on their water bill so that they can better afford the sewer bill. So if they save $10 a month on water, that means their sewer bill is only going to be $10 a month. So I think they can better afford that. So that was a huge thing in getting community buy-in. But just like Christopher said, having started meeting with this group in the consortium, typically twice a year, it seems to support one another. We know what each other is doing. We help identify where the barriers are next, and then we can start talking about how we overcome that barrier. So starting with the community leader, the regulatory folks, I think that's a good plan.
Yeah, and I have to say that the government relations people at University of South Alabama reached out to the staff of some of the congressional offices, and that helped a lot. Once we got them involved, I think people saw that we really had a serious chance of addressing this problem. And I really appreciate the buy-in from the health department as well, giving us the space to meet and also having a lot of staff involved directly in our consortium.
And another thing that's kind of struck me too, as we've kind of interacted over the months is, and you've all had an opportunity at this point to interact with other communities, that are facing similar or facing other decentralized waste challenges. And I'm kind of curious to hear kind of from your perspective, like as you've had these interactions and these conversations about what's going on in Lowndes County and what's going on elsewhere, whether it be Hawaii or New York or on the Navajo Nation, what have struck you about elements that you find you all share in common, and what has surprised you about things that you don't share in common that makes each kind of experience unique?
Well, there are some. Now, we haven't done a very deep investigation in other states, but through literature review, we did find 15 states where there were documented straight pipes, and I'm sure there are more where it simply isn't documented. And we published that late 2020. And that was kind of the first attempt to actually gather all the information about straight pipes in the United States. So other communities do have these problems. They're dealt with very differently. There's a lot of differences in the state-to-state regulations and who has responsibility, whether an installer needs to be permitted, and all of these different elements. One thing that does seem to be pretty different between the Black Belt of Alabama and Appalachia in terms of the problem, addressing the problem technically, is the topography. So the step systems with the pumps that come inside those, they can really, in a relatively flat environment, move a lot of wastewater pretty easily and pretty far. But if you're talking about the mountains of West Virginia or Kentucky, it might be a different situation. They might need a different sort of technical approach. That would be just a couple examples that I could think of.
And Christopher, let me say this, by being regulatory, a lot of people think we can just go on people's property, but we can't. Actually, we can't without their permission, because once we see a situation, we have to act on it. But what I've said was, for Lowndes County, until there's a solution, why are you going to act? Unless you're generating sewage that's going on your neighbor's property, because your neighbor has a right for that sewage not to be on his or her property. But we've had to be very careful, especially me in this project. I'm regulatory, but I'm trying to help outside of my responsibilities. So it's tough.
I would also say that, from a bigger perspective, there's a lack of either state or federal funding historically for these rural small communities or on-site entities. If you're a person in one of these Black Belt counties and your income level is $25,000 a year, how do you get assistance in putting in a system? Most of the installers that come out and put in a $5,000 or $6,000 on-site system, they want to be paid right away. You typically can't pay for that over time. There's no state revolving fund for on-site systems where you can go and borrow $6,000 or $7,000 and pay it back to the state over, say, 10 years. So this funding mechanism, and that's just for the on-site. Same thing for these small communities. Where do they go get funding, and where's the assistance to get the type of funding they need to put in a 1 or 2 or 5 small decentralized systems that may in total cost $1 million, but that's not really a lot of money in terms of the sewer industry. Where do you go and get that kind of funding and be able to affordably do that for a small community? I think that's been a big limitation in a lot of places: Appalachia, Hawaii, Alaska, Alabama, you name it.
Okay, Dr. White, let me add to that. Take a brand new mobile home. When a person purchases one, they can get a system financed with the mobile home. Number one, some choose not to. But number two, one of the problems I showed earlier, the air property, they have to own their land, and they don't, some of them. The land is not clear title. So that's out the window. Now, when I did mention to some of the people that you can go through USDA for a home improvement loan, because the on-site sewage disposal system is part of the home, you can get an improvement loan at a low interest rate. The first thing they say, I don't want a loan. So it's hard.
Right. It almost seems like there needs to be some model legislation that could be, transferable from Alabama to Mississippi to Hawaii, et cetera, on how to deal with this, that we don't have. Some states may have it. I mean, the the cohort group that we're working with in these multiple states, we found out in New York, they do have a loan program for on-site systems. The state operates a loan program, but that's the first time I've heard of that for on-site systems.
Yeah, and I want to say to all the attendees, if you have insights on approaches that have worked in your state, or even approaches that haven't worked that we could learn from before we do something that didn't work, we would love to hear more about the experiences that everyone has had. I also want to say that we probably had maybe an unfair advantage relative to other states in terms of getting our federal congressional delegations involved. The work that the activists have done, mostly Catherine Flowers, to draw attention to this issue, get it in national newspapers and international media, really has increased the pressure on people at the state level who are associated with Alabama to solve this problem. So that work really that happened in the background, oftentimes many years before I started working on this, was really invaluable in us being able to get our consortium together.
Here's another technology-related question. Someone asked about composting toilets. Were those considered as a potential solution for the challenges here?
Yeah, we looked into it many years ago. No one wants to use a composting toilet. Everyone wants to flush and forget. And frankly, we need solutions that are aspirational. You know, you hear about this a lot in developing countries, WASH programs. People don't want something that seems like a technology for poor people to them.
Okay. All right, a question from Louisiana, where they have straight pipe systems that go right to ditches, roadside ditches, and it's a big problem with mosquito production. So the question was, has anyone from this group investigated mosquito production at the pipe and the stagnant water that's downstream?
I have not. I did work with some people in Louisiana to look at that problem very briefly. It's a major issue in Louisiana where they have aerobic treatment units that are often not plugged, they're often unplugged. So it's basically just a septic tank that runs raw sewage directly to a trench in front of the home. And I know they've investigated that some in Louisiana, but it would be very worthwhile for us to do a parallel investigation in Alabama. Thank you.
We did receive a couple questions from the audience regarding costs. Now, I think part of this ties into kind of what we kind of let off with, is that we're still wrapping our minds around really the scope of the whole issue in the country, right? There has been some great work that's been done by, out of Columbia, with Dig Deep and the U.S. water lines. But do you have a sense of, what would be the national cost to provide, majority coverage to those who are on, failing systems or on open pipe systems? Curious if in your research, if you've come across anything like that.
No total cost estimates. Frankly, if you just define the problem as straight pipes, it's hard enough to get a number with which we can be confident. They're illegal. These are, it's an illegal condition. So there's not a lot of data actually collecting information on how common it is. So we have reliable estimates in a few counties here and there. Actually, Minnesota probably has the best estimates for the total number of straight pipes and failing systems across the state. Eastern Kentucky, there's a lot of data. It's a couple decades old, but pretty thorough across about 40 or 50 counties. We have it for a few counties in Alabama. I talked about some of that today, but we still need to do a lot of work to define the scope of these failures. And when you start to talk about what's a failing system and what's not, there's both hydraulic failure, which we've mostly been talking about, where wastewater comes up to the surface. And then there's also what's called environmental failure, where you have through the subsurface, but an adverse environmental effect at a distance. So trying to figure out how many systems are failing, even under just hydraulic failure, let alone environmental failure, is not currently feasible as far as I know. Carl may know more about national level data on failing systems through NAURA. I don't know, but if so, Carl, please chime in.
Yeah, the statistics that I've seen are ones that I mentioned early on, that there's 2.2 million Americans are not served by basic sanitation. The flushed and forgotten report, I think the number was that there are at least 200,000 homes in the US that don't have any type of wastewater system. So there's a big gap between that 200,000 and the 2.2 million Americans, but it's a big number. And you know, the dollars that are in the federal legislation now are going to make a small dent in fixing this problem. If that legislation passes, I think we're going to need more.
Yeah, one of our goals is to provide proof of concept of what can work in a low density, low income community, and to show that once we can get to economies of scale, we can actually come up with a financially sustainable solution. And that's hopefully, once that occurs, then we can really talk about scaling up across many states and hundreds or thousands of communities.
That makes sense. Another question came in, deals with the regulatory environment. So Sherry, maybe this will put you on point for this one. They wanted to know, what are the current regulatory requirements in Alabama for a soil evaluation survey of an individual property prior to receiving a health department permit for an on-site sewage system? And the example they give is in Virginia, where they require at least 3 soil boring or pits in the proposed drain-filled area.
And it's the same here. We do require those soil borings. We have soil scientists on staff that if they can get to the person that's requesting this, fine. But we also have local environmentalists that have been trained to go out and do the soil testing. But it's the same here, that it has to be in the area where the disposal field will go, and the 100%. We have the disposal field and the 100% expansion area in case there's failure. So it's the same here.
That's very helpful. Another question is why they want to know, Kevin, perhaps this is for you, why the 30 home minimum for home clusters? Wouldn't there be economies with clusters of 10 or 15 homes, certainly compared with individual systems?
And that is a good question. And that number of 30 plus, homes is kind of pulled out of the air. But obviously, the more homes that you can cluster together, the more income to pay for that long-term operation and maintenance of a somewhat sophisticated system you have. And that's just going to be looking at the financial numbers. So we're going to have to look at, I don't know where that break point is. Is it 15 homes? Is it 20 homes? Is it 30 homes? We'll have to look at those numbers. But for an individual system, cluster system, operated by one individual management entity for that system only, I think it's going to have to be more than 10 or 15 homes. It's going to be more like 30 or 40 or 50 homes might be the minimum. That's why we're looking at maybe having a management entity that is a broad umbrella entity for the whole county that would operate multiple cluster systems, or maybe multiple counties, so that there's multiple systems that they are operating. That means the customer base supporting that long-term O&M makes it financially much more feasible.
A question comes up around the operation and maintenance of these systems. So the septage that's pumped out of a system from time to time, are there any challenges with dealing with that septage? Are there capacity issues relative to take care of that?
It is. We don't have enough places that will take it, nor is it the proximity sometimes is far away from where the tank is pumped to where they have to take it to the treatment plant and dump it. We have tried our best to get people to understand that I'm trying to think of the proper name. Dr. White, help me out. Where you come in and you
Land application.
Land application. Thank you. We're trying to get the public to understand that land application forms are essential, because what can happen, the tank can be pumped out, they can take it to land farming, it's spread out, it's treated. We just went through a bad time with a man that had a land application farm. The community didn't want him there. He ended up killing himself because it was too much for him. I mean, they dogged him day and night. But the fact is, when we tried to explain to them that you need these type of land farming facilities, they just don't understand. So people that live in one county has to go 2 counties over once their tank is pumped to put it in the sewer disposal treatment system.
And she's talking about land application after lime treatment, so high pH to kill off pathogens, and then application, into pasture land or hay land or something like that. So it has to be done correctly, and there are guidelines to do that. You have to have buffers. You have to have, provisions for doing that when it's not rainy and things are not going to run off directly right after an application. So it is more difficult, but that is something we could probably add that to our barrier list as well.
We just updated our land farming rules as well. It's been maybe 2 months ago. We had to, because if the city doesn't put some type of jurisdiction where these land farmers can be placed in the city, because this guy was like 1 mile from a ball field, and that's what caused all the problem. The family didn't want it there.
Here's an education-related question, and the questioner makes the comment that the vast majority of wastewater engineers don't have a deep knowledge of alternative or decentralized wastewater treatment methodologies. What can we do to raise the education level of new wastewater engineers or existing wastewater engineers?
That's a really good question, and Mark, it's going to be on you.
Okay, sure.
I'm going to say, one of the issues right now is, if you take in my program, a civil engineering program, you're going to take 2 environmental engineering courses that talk about wastewater, and the 2 textbooks that we use, and both of those don't have any mention of on-site or decentralized wastewater. And so you're right, that a lot of engineers come out of college, get their PE license, and they've never heard of it.
Yeah, I think that's a really important point. And I'm going to look up a book that's written by Robert Sigrist on decentralized wastewater, so I can get the title right. It's called Decentralized Wastewater Reclamation Engineering, and it's a oh, look at that. Look at that. Carl's got a copy of it within
awesome
reach.
Book. Go out and buy it.
Yeah, it's a fantastic book. And it's actually a curriculum for teaching a course. It's actually got slides that you can use for presentations as part of each chapter. So if anyone is teaching environmental engineers and wants to incorporate decentralized wastewater into their curriculum, you could do it 1 lecture, 2 lectures, and there's basically material ready to go. I think it's a very valuable contribution. The book is a little expensive. I got a PDF. I think Robert sent me a PDF, but I would really recommend trying to find a copy of that book if you're interested in introducing some content. And I have to tell you, the way that infrastructure costs are increasing, the state of our wastewater infrastructure or sewer infrastructure in the United States, and the fact that these decentralized systems are becoming much less expensive is going to make it essential for our next generation of engineers to know decentralized wastewater really intimately, in addition to knowing just the basics, at least, of on-site wastewater.
Right, and I think we also need to get that information into the mainstream textbooks. I would use, Dr. Sigrist's textbook in maybe a graduate level course, but in an undergraduate course, you'd have to pull certain sections. But we need to get that into the mainstream textbooks as well.
Well, I think, unfortunately, we're going to have to end it on that note. But I think that's an important, point to leave it on. On behalf of Carl, myself, Kevin, Sherry, Mark, we want to thank you for your time and sharing your experience and your expertise with us today. I know there's still a number of questions that we didn't get to, and we'll look to follow up with those questions via email with individuals that pose them. And at this point, we'll turn the time back over to Zach Lowenstein with EPA.
Yeah, and feel free to look up our emails online. You can find my email, Kevin's email. You can probably find Sherry's email online, and just email us with questions. We really want to interact with people around the country who are dealing with issues in their context.
All right. Well, thank you everyone for attending today's webinar, and thank you to our speakers. This webinar will be posted online at epa.gov/septic in the coming weeks. So obviously, if you're here, you didn't miss it. But for those that did, or if you want to catch any of the information that was discussed, you can find it there. It was highly informative. I certainly learned some new things. So Dr. White, Dr. Elliott, Sherry, I can't thank you enough for volunteering your time to be here today to speak on this highly important topic. We also had a great discussion, clearly, and thank you again to Chris and Carl for moderating. And as Chris had mentioned, for the questions that we were unable to get to, we do have email addresses of the attendees and have been recording those who have been asking the questions. So we can get those questions to our speakers to provide an answer. So with that, I will close out this webinar session. Please feel free to contact us with any questions, and have a great rest of your day. Thank you.
Thanks.